Dr. Dutton, you now have the floor.
Good morning. I'm an associate professor at Dalhousie University in a department called Community Health and Epidemiology. I'm also a member of a research group called PROOF, with members across Canada and the U.S., who have a goal of identifying policy options to reduce household food insecurity in Canada. I want to open by pointing out that household food insecurity is a specific scientific concept. It sounds like it should be the opposite of food security, but it isn't. Household food insecurity is the inadequate or insecure access to food due to financial constraints at the household level. Food security has been used to refer to everything from our ability to produce enough food domestically to feed our population, food supply chain, access to food banks. Food security, therefore, is a term inclusive of many problems that have to do with food, and people sometimes conflate action on anything related to food with solutions to household food insecurity, which is not correct. This inappropriate combination of household food insecurity with issues grouped under the banner of food security complicates the language for people in government trying to grapple with the problem of household food insecurity. So some find it helpful to think about food insecurity as part of consumption poverty, and so is related to challenges attributable to general affordability, cost of living, labor market, outcome inequality, housing, like we just heard. Statistics Canada measures household food insecurity using a specific questionnaire that's been agreed upon by researchers to accurately measure household material circumstances. That means efforts to decrease that measure will improve the lives of Canadians by improving their health and decreasing healthcare demand. For reference, about 1 in 4 people in Canada are in food insecure households. I know the Standing Committee has heard from government employees from AAFC and ESDC and others, who have also emphasized that food insecurity is tied to income, and I heard it all morning, so that's great. This is consistent with decades of research on food insecurity. PHAC recently published reviews on what impacts food insecurity in Canada and came to the same conclusion. Food insecurity is improved by actions that decrease financial hardship. Those reviews identified that giving households food through in-kind mechanisms does not make much of an impact on food insecurity. The idea that giving a household food does not impact food insecurity is a major sticking point for many people because it sounds unintuitive. The reason this unintuitive idea is true is because of what household food insecurity reflects, the structural factors facing a household. Those can include the adequacy and stability of income, unexpected expenses, cost of living, none of which change when we deliver food. AAFC's own audit of the Local Food Infrastructure Fund and the Auditor General's review of the Emergency Food Security Fund and Surplus Food Rescue Program also found no evidence of these programs reducing food insecurity. The National School Food Program has potential to do good for education outcomes and student nutrition, but for reasons I mentioned, we wouldn't expect it to be a major factor lowering future household food insecurity. People will appreciate the benefits they receive from national school food or community food programs. However, these programs are not going to impact household food insecurity because it is not necessarily a food availability problem. In Canada, we address many other important problems without in-kind transfers and end up improving household food insecurity. I'll give you an example from my own research. Old age security is more generous than social assistance. The research shows that when low-income individuals turn 65 and qualify for these public pensions, their likelihood of being food insecure decreases. I want to point out that old age security is not making households incredibly rich. These benefits are adding stability to a household's budget, and that budget faces rapidly rising food costs along with housing costs and general inflation. In closing, I'm a researcher at a faculty of medicine, and I care about the implications of household food insecurity for Canadians. Treating the symptoms of food insecurity will not decrease it in the population, just like having excellent cancer care will not decrease the likelihood of someone getting cancer in the population. Most Canadians, I guess, would probably prefer to prevent cancer than to have excellent treatment for cancer when they get it. Similarly, the prevention of household food insecurity is more effective in terms of overall health improvement. So decreasing household food insecurity in Canada means acting on these social issues that drive it. That means acting high on the chain of events that leads to food insecurity. That action is uniquely possible through intervention at the federal level. For example, income policies managed by ESDC. That action is not food-related, despite initial impressions it should be, and it does not really fall specifically on the shoulders of agriculture or agri-food.